My name is Brandon Meister. I am the Outpatient Therapy Supervisor, a Certified Lymphedema Therapist, a Doctor of Physical Therapy at the Rehabilitation and Orthopedic Institute, a program of the Palmdale Regional Medical Center. At the Rehabilitation and Orthopedic Institute, we offer physical therapy, occupational therapy, and speech therapy. Our speech therapy tends to focus on cognitive disabilities, the ability to swallow, ability to process and coordinate things. Our occupational therapy tends to focus more on the fine motor skills, integrating your ability to utilize your hands to perform different kind of tasks. Our physical therapy has probably the widest scope, where we do gait training, walking, running, jumping, sports prevention, arthritis rehab, across the board. We have the largest square footage probably out of all the clinics in the Antelope Valley, allowing us to offer all three disciplines in one convenient location. Large square footage also allows us to maintain the social distancing and help keep our patients separate in individual locations, so we don't have to worry about the same kind of cross-contamination that maybe smaller facilities will have to deal with. Our lymphedema program here offers treatment for chronic swelling conditions that range from chronic venous insufficiency or post-surgical, post-breast cancer therapy. Any type of swelling that doesn't easily resolve typically requires a more in-depth intervention. We offer the only certified therapist in the Antelope Valley to provide the comprehensive care that's needed for it. We do comprehensive multi-layer bandaging in addition to manual lymphatic drainage to provide complete decongestive therapy to create the best treatment approach. Our pelvic floor therapy program incorporates therapy for both men and women. Typically, most commonly, we see it with women, postpartum issues, incontinence issues, as well as any type of dysfunction in the lower quadrant of the body. We have multiple therapists covering both regions and providing the comprehensive care that's not available at anywhere else in the valley. The Rehabilitation and Orthopedic Institute is a hospital-based therapy program. As part of that, we require a physician referral in order to initiate any type of care. But because we are a hospital program, we are able to dedicate more one-on-one time with any of our patients. One of the benefits of our clinic is we have an anti-gravity treadmill, which allows us to eliminate up to 80% of your body weight through the use of a vacuum chamber. It reduces impact to the whole body, specifically the legs, hips, knees, ankles. It works really well for any type of arthritic condition, post-surgical condition, allowing us to limit the stress that your body goes through, while allowing us to really focus on the mechanics of how you're walking or how you're running. With our Alter-G system, we have 3 different cameras to show different angles of your legs, and it hooks up to a video system so that you can actually watch yourself walk and correct your actions as it happens. Physical therapists are going to sit next to you side by side and describe what's going on and help you correct it and give you the corrections and interventions that's needed in real time. Every intervention typically requires more than one session. And our treatment plans typically cover a variety of weeks, and allowing us to fully correct and ingrain the proper mechanics into every one of our patients. The Bionis Integrated Therapy System, or the BITS as we like to call it, is an integration of visual, tactile, and sensory development. It's a large touchscreen which allows us to have visual tracking, motor skills, coordination between hand and eye, as well as incorporating it into complex balance coordination programs. So we'll use it in the middle of our interventions with our patients or treatment sessions, and we'll use it for anywhere from the whole session to parts of the session. It's going to integrate your visual coordination, hand-eye coordination, as well as balance, proprioception, and we'd use it for vertigo and dizziness treatments. With the BIT system, we also treat strokes, Parkinson's, any type of visual motor impairment. So if you have difficulty reaching for objects, maintaining your balance, we can do it in a seated position or in a more dynamic standing position as you reach outside your base of support for any kind of object. If you're practicing reaching for a cup or the microwave, it allows us to coordinate and have a visual input feedback into the patient. The progression is entirely dependent on each individual. If you're having difficulty standing in your kitchen reaching for objects, we'll do it in a standing position to simulate your home environment. If you're in a wheelchair, and you're having difficulty reaching for stuff out of your wheelchair, we'll customize it to make it fit each person. We are held to the highest standards of infection prevention. We are routinely disinfecting any points of contact from door handles, the waiting room, the chairs. Every surface that a patient may come into contact is cleaned before and after every patient. Because of our large square footage, we're allowed to maintain the social distancing. We keep our patients separated from room to room, from bed to bed, and there's rarely a chance where you are directly in contact with another person. Everyone is required to wear a mask, with a few exceptions of high respiratory conditions where we're going to put you in a private room or a private area to separate you and reduce the risk. My staff is a combination of occupational therapy, physical therapy, and speech therapist. We all work as a team. They're excellently trained. We have a variety of backgrounds so that we can approach projects from different angles and get everybody the care that they need from all aspects of life, so we can truly get you back to what you want to do.